Is it possible for a hepatitis C patient to fully recover? The hepatitis C virus is one of the most serious viruses that infect the liver, and the question of whether a patient is entirely cured arises. Is it possible for a hepatitis C patient to fully recover? Many individuals are curious as to whether or not a hepatitis C sufferer is entirely cured. What really is the truth? In fact, thanks to the discovery of new medicines for the virus, hepatitis C can be healed with the correct medications, such that these treatments eradicate the virus and help prevent major liver consequences. The majority of instances of hepatitis C require therapy since the viral infection is chronic, but there are a small number of cases, about 1 out of every 4, where the sickness is only transient and the patient does not require medication. Is it possible for a hepatitis C patient to recover entirely after a second liver transplant? Because the virus lives in the patient's blood, removing the liver will not rid the body of the virus, and transplanting the liver while the virus is active will cause damage to the new liver cells tissues as well. However, in the event of problems from the hepatitis C virus, such as liver cancer or the failure of the liver to execute its duties, doctors may resort to liver transplantation. What is the treatment for hepatitis C? Is a hepatitis C patient fully recovered once you know the answer to the question? The doctor's treatment options are determined by the virus's genotype, the state of your liver, and the presence of any other health issues you may have. The presence of a sustainable biological response, which means that the hepatitis C virus continues to disappear in the patient's blood for 12 weeks or more after the treatment plan is completed, and a sustainable biological response means that the disease does not return for the rest of the patient's life, is a sign of treatment success. Doctors frequently recommend re-administering the medication or waiting for new treatments if there is no response to treatment and no sustained biological reaction. Antivirals are drugs that are used to treat hepatitis C. Did you know that a person with hepatitis C can be entirely cured? Antivirals are drugs that are used to treat hepatitis C. They are directed towards the virus and kill it without harming healthy human cells. Fatigue, headache, diarrhea, nausea, and vomiting are some of the minor side effects of these medicines. Continuing the subject, can a hepatitis C patient fully recover? The hepatitis C patient recovers within 8 to 24 weeks of starting the therapies, and the treatment's effectiveness is demonstrated by the hepatitis C virus being eradicated. Here are some of the antivirals used to treat hepatitis C. Protease inhibitors are a type of drug that is used to stop the production of. This group acts by preventing the hepatitis C virus from multiplying by blocking the protease enzyme. 2. Inhibitors of polymerase. Sofosbuvir is a polymerase inhibitor medicine that works by disrupting the virus's DNA to prevent it from reproducing, and it can be combined with other drugs to treat the virus. 3. Inhibitors of the NS5A protein. This group is critical in preventing viral replication by inhibiting the NS5A protein, which is involved in the replication of the hepatitis C virus. Hepatitis C virus research and new cures. There is no vaccination for the hepatitis C virus, and new research is focused on developing a DNA-based vaccine that boosts the body's antibodies and allows the infection to be eliminated naturally. In 2019, a new treatment was launched that included 2 anti-HCV drugs, glecaprevir and pibrentasvir, and was given for 8 weeks rather than the usual 12. This therapy is approved for use in adults and children over the age of 12 who have not previously received hepatitis C treatment and who do not have cirrhosis or mild hepatitis C illness. Instead of previous methods such as biopsies, which raise the risk of liver injury, transient elastography and magnetic resonance elastography are used to help detect the status, inflammation and cirrhosis of the liver. Vaccination against the hepatitis C virus. The hepatitis C virus is spread by infected blood, and it can be passed from a mother to her fetus or through sexual contact. Here are some strategies to keep the hepatitis C virus from spreading. Avoid injecting narcotics if at all possible. Never give out syringes, razors, or nail clippers to strangers. If you work in the medical field, follow all safety procedures. If one of the spouses is infected with the virus, use a condom during intercourse.